When my son Joe, who just turned 32 a few weeks ago, was 6, and going into grade 1, I asked him what he would like for lunch. Joe had never been a picky eater, had eaten everything at daycare, even squash soup. So I was quite surprised when Joe asked for a salami sandwich and a bag of chips and a pop. Joe explained that the lunch lady volunteers at the full industrial kitchen in his 100-year-old school basement served 3 things: slices of pizza, hot dogs, both warmed up in the microwave, and no-name pop, all a loonie, no change made. Imagine that, a can of pop, 6 to 10 or 12 teaspoons of sugar to get a kid through the afternoon. And then think about the kilograms of sugar in that child's body over his or her lifetime. I knew that things were done differently all over the world. I had participated in a hot lunch program myself, growing up in the United States, and I knew that Canada was one of the only industrialized countries in the world that doesn't have a national school food program. So I went to the principal, who was actually a very good principal, and I said, "We can do better." And he said, "Debbie, go away. The kids won't eat healthy food. The lunch ladies certainly don't know how to serve healthy food. And if I tell my teachers that they have to do another thing, they'll kill me." I then realized that the challenge of ensuring that every child in Canada, regardless of their parents' income, would have at least one healthy meal at school a day was going to take quite some doing. Luckily, right at the same time, the winds of change were beginning to blow on this issue across the country. A group of us in Toronto, parents, city councillors, including then City Councillor Jack Layton, 2 trustees, Olivia Chow and Pam McConnell, educators, and a group of us approached the city, and we were successful in convincing the old City of Toronto to invest $180,000 to create 8 pilot programs that began to serve healthy food. My principal was happy. That program continues to this day. And I have an amazing number now to share with you. 177,000 kids a day now get a healthy breakfast, lunch, snack, or mid-afternoon snack in the City of Toronto through a really great partnership between all of the school boards and their foundations, public health, and community groups like FoodShare, my organization where I work. FoodShare has been around for 30 years. And we've helped invent a variety of programs like the Good Food Box or Good Food Markets, school gardens that are now replicated all across the country. Last year, 260,000 adults and children participated in one of our programs. And with our partners in groups like ours in Toronto, all across the country, the good news is we have a lot of grassroots school food programs, but we're at a tipping point. If the federal government does not give us standards and a matching funding, this grassroots movement of parents and programs will fall apart. Why is this even important? Why do we even care about school food programs? For 3 fundamental reasons. 1, for health, both short and long term. 2, for educational impacts. And 3, for the local economy. We know so much now about food and its impact on health, and especially the importance of vegetables and fruits. Look at the great lunch we just had and think that no grouping of adults would get together for more than 6 hours and not ensure that a meal was fed. And yet we have constructed in Canada an entire school system in which food does not enter into our thoughts even once. And that is having a huge problem for our children on a multitude of levels. War is actually the time when most governments have implemented a school food program. When the generals see unhealthy 18-year-olds, they figure out a way to invest in feeding children from the youngest ages. The oldest program we know is from Sweden, the war in Finland and Sweden 400 years ago. Surely now, with the kind of crisis facing our children, and if you follow just a few weeks ago the World Health Organization's recent predictions about what is going to happen if we don't intervene, surely this is a war. And this certainly is a time that necessitates some very drastic measures. In those schools where children eat, we notice right away less headaches, less earaches, less dizziness. But more importantly, we know about the long and short-term impacts of changing how children eat while at school. A third of primary school kids come to school with something in their belly. 2/3 of high school students have not eaten anything when they get there. And breakfast skipping is not just about whether there was money in your house. There's a variety of reasons why kids might skip breakfast. 2 parents rushing out the door, getting up in the middle of the night to get on a school bus, eating disorders of all kinds, fighting with your parents about what's for breakfast. For all of these reasons, having a school food program that can capture all of our children through a universal program is very important. For those third of families who live in poverty, the most important thing that governments need to do is ensure adequate income. We do need to raise minimum wage. We do need to raise minimum welfare rates. And that's why all over the world people are beginning to talk about a guaranteed annual income. But if you were a parent who was living in poverty, think about how much security you would get from knowing that your child was going to at least have a regular healthy meal each day. I mentioned that I grew up and participated in a subsidized hot lunch program. I qualified for that program because my mother, a widow, worked for minimum wage jobs in the retail sector. The student nutrition program did not get rid of the poverty of my childhood. But my mother says how good she felt knowing that I was going to have that hot lunch and knowing that she could serve something simpler for dinner like noodles and cottage cheese. I also picked up some other issues in that student nutrition program. I would line up with my girlfriends in the line to a certain point, and then I went into the free hot lunch cafeteria with the other subsidized kids, and my girlfriends would go into the other line where your parents could afford to pack your own lunch. So along with the great meatloaf and mashed potatoes and peas, to this day my favorite comfort food, I picked up stigma. And what we've learned is if you want to ensure that the poorest kids eat, it has to be a universal program. If you put up a sign and say, hey, this is the poor kid cafeteria, people will rather go hungry than eat. And this sense of universality is really important when we look at this next big impact of school food programs, which is the kind of impact they can have on education for all of our children. We now have hundreds of tests. The Harvard Business School recently put together 100 tests that show that all kinds of educational impacts, from test scores to attendance, go up when you feed children. In Toronto, the Toronto District School Board did a study, and when you have a universal snack program, test scores go up on average 10%, and also less absenteeism and a variety of other problems in the school. So when we invest in school food, we create a different environment in the entire school. I've walked into the largest school in Canada where hundreds of children are sitting down on a mat, kind of similar to this mat, in their mid-morning snack program, everybody having a bagel, a slice of cheese, and an apple. The calmness, the sense of solidarity, really the commensality that gets created when people break bread together. This is crucially important. In another school, a principal told me when somebody would come in late, a high school student, he'd say, quick, go to the office, get your pink slip, take your hat off. And now the principal says, hey, go get the mid-morning snack so that you're not hungry. We can change our schools, improve our schools, make them centers of excellence by bringing food into the equation and teaching children how to cook, grow food, and budget. At what age does a child need to know the difference between a hard and soft-boiled egg? At what age does a child know how to germinate a plant? At what age does a child know that they can use their budget in an elastic way to survive when money is tight? My daughter Molly, who's just turned 29, tells me that it was the food literacy skills that she learned in our home that kept her and her friends from going hungry and running out of month when they were university students, far from home, many of them vegetarians, not knowing how to eat, not knowing how to survive on a budget. But because she knew how to cook, they could make a 3-bean salad or a soup when money was tight. So in making these changes, we make changes that have such impacts on health, on education, and most importantly, on the long-term health. Because we know right now that close to half of our budget is taken up with chronic care costs of diseases that we know diet plays one of the many contributing factors. What happens to this massive epidemic of childhood obesity and diabetes if we can think of a way of investing in children's health when we should? The third big impact is the economic impact on the local community. Imagine if every school in the world was able to supply the food that the children in that school eat from local farmers that grew food and that prepared bread, meat, cheese. Imagine the jobs in the local economy. Imagine the jobs in the school if we actually paid cafeteria workers. FoodShare, the organization I work with, bumped into the Norfolk Fruit Growers Association almost 20 years ago. And the Norfolk Fruit Growers are a co-op of farmers in southwestern Ontario, 10 different farmers who all use the same bag to bring their beautiful fruit to market. They had a little apple, a little undersized apple that they did not know what to do with. They'd leave it in the field or export it for juice or export it to England or make it into juice in Canada. And we found a use for it, for kids to have that little beautiful crunchy apple in schools. We bought $175,000 worth of apples from Norfolk growers, and last year another $1 million of produce from other local farmers. So there's tremendous economic activity and also tremendous deliciousness in that relationship. We've created the Great Big Crunch, which we do once a year in March, where at a certain time on an afternoon, everybody takes an apple bite, and it's both delicious and fun and reminds us that even in Canada, even in the winter, there's tons of stored food that we can still eat. And I mentioned jobs in cafeterias. Betty Wiggins in Detroit has done some amazing stuff. Betty inherited a cafeteria system that was just about to go defunct. And the Detroit School Board and the unions asked Betty if she could come in and do something to change it. 5 years later, Betty now is employing 500 women, feeding 50,000 kids a day with annual revenues of over $50 million. And so it is possible to look at job creation in a new way too, if we look at schools. So if we think about this and we look at the health, economic, and educational benefits of a school food program, and then we think, okay, now that we've done this, what else can we do for the whole society that maybe replicates what we've learned from the National School Food Program? First thing I think we need to think about is, do we actually have enough food in Canada to feed everyone in Canada? This term food security, which is kind of a weird term and usually not very explainable, comes from the UN in the 1970s. There was a meeting in Europe, a World Food Organization, and they said, do countries have enough food to feed themselves? In 9/11, there were exactly 5 days of food in the New York City stores. We did a similar study in Toronto and found a similar reality. What happens if the border between the United States and Canada closes, the border between the United States and Mexico closes? Does anybody in Canada know whether we have enough food to feed all of our people? That's why governments have begun to think about making someone responsible, a Minister of Food Security, whether it be the Minister of Health, the Minister of Agriculture, the Minister of Social Development, to ensure that everybody in that country can be fed. And if we look at the great benefits of a school food program and then look at it for the whole society, what else can we learn about? How would we ensure that everybody in Canada had adequate access to affordable, healthy food, especially vegetables and fruits? In Kerala State in India, they, for years, used to subsidize grains and beans and make sure they were available everywhere in all the outlets. The government bought it up from the farmers and paid a fair price, but everybody, regardless of their income, bought it at a stable price. What if we took 5 things? Cheese, soy nuts, apples, carrots, and broccoli, 5 things we all grow abundantly in this area, and we made sure that those products were available for the entire population at 20 cents a kilo, everywhere, even where we bought our smokes at the convenience store, and the Ministry of Health picked up the difference in terms of savings. There are so many ideas from around the world that have shown what happens when governments begin to look at subsidized basic food as a way of ensuring that the whole population can eat. And nowhere is this more urgently known right now than in our First Nations community in Canada. FoodShare has been working in partnership with leaders in the North on a couple pilot programs where, along with hunting and gathering, the next food that needs to come into the community are fresh fruit and vegetables from the South. In Fort Albany, in Attawapiskat, in Saskatchewan, in Moosonee and Moose Factory, community leaders are buying fresh vegetables and fruits through FoodShare. We're sending them up by truck, train, and plane, and community members are selling them in a marketplace. That's another thing that could really happen to improve people's access to healthy, affordable food. So when we look at school food, and then we begin to think about what we can do for the whole society, What looks like an almost insurmountable problem begins to actually become quite simple. We in Canada pride ourselves on having a national healthcare system, and yet food and healthy food, which is the absolutely fundamental building block of anyone's health, is in the marketplace and outside the reach of so many. We had a woman work for FoodShare years ago, Kate Sigurdson, who unfortunately since has died of breast cancer, and we set up a bunch of programs for women in their after their active treatment for breast cancer. And Kate used to say, they'll buy me any amount of free chemotherapy, but no one will help me get any healthy food. As we look at what we know about food and health, we have an opportunity to make tremendous changes. Some of our problems are really complicated. Other of them are very simple. And getting and ensuring that all children in school have healthy food leads us along a pathway to food security for Canada, with solutions that will ensure that everyone, rich or poor, has access to the healthy food they need. And the first step in this process is a national school food program. Thank you.